Hello and welcome. You're watching Tracking COVID-19. I'm Anil Thomas. This is our special half-an-hour show in which we tell you all the developments on the pandemic. We also get you inputs about steps taken by the administration, inputs by our correspondents, global developments and experts' advice. We'll be getting you the latest on Indian stranded abroad, getting evacuated while migrant laborers also find their way back home to their home states. A story from the hill state of Uttarakhand, where AIIMS unveiled remote health monitoring systems, will be a big focus of attention in the next 30 minutes. Let's begin with the top updates. India's massive evacuation mission Vande Bharat continues bringing back Indians. 6 flights bring back 1,082 Indians from 5 different countries on second day. Indian Navy to bring back stranded Indians in 2 ships during the first phase of evacuation. INS Jalashwa sets sail from Mall to Kochi with 698 Indian nationals. Railways run 265 Shramik special trains for movement of stranded persons. Transports more than 3 lakh people to various states across the country. Home Minister Amit Shah writes to West Bengal Chief Minister Mamata Banerjee on the state's failure to make arrangements for return of migrant labourers. Active cases of COVID-19 in India rise to 39,834 with 17,846 recoveries and 1,981 deaths. Health Ministry says recovery rate improves to almost 30%. Union Health Minister along with MOS hold meetings with health ministers of Tamil Nadu, Telangana and Karnataka through video conferencing. Coronavirus cases continue to increase across the world with over 39 lakh cases. Fatalities rise to 2,74,000 people while 13 lakh recover from the disease. COVID-19 cases in the United States reached 12,83,000. White House reports second positive case in consecutive days. United Kingdom continues to remain worst affected country in Europe with over 31,000 coronavirus deaths. And COVID death toll in Italy crosses the 30,000 mark. Government urges people to follow safety rules amid partial ease of lockdown measures. Well, let's begin first by taking stock of the developments in India in Ground Zero. India's massive repatriation exercise, codenamed Vande Bharat, is undertaking the process of bringing back Indians back home stranded abroad due to COVID-19. Today, on day 3 of the exercise, flights will arrive from Dubai to Chennai, from Dhaka to Delhi, and from Kuwait to Hyderabad, to also flights from Muscat to Cochin, from Sharjah to Lucknow, from Kuwait to Cochin, and from Kuala Lumpur to Tirchi. Besides, in the first phase of the UK-India segment of Operation Vande Bharat, around 2,100 Indian students and tourists stranded in the United Kingdom due to the coronavirus-induced lockdown will be evacuated by 7 flights starting from today till the 15th of May. Passengers to both the first repatriation flight from London to Mumbai on Saturday. Other flights from London's Heathrow Airport will depart for Bangalore on May 10th, Hyderabad on May 11th, Mumbai on 12th of May, while flights for Ahmedabad, Chennai and New Delhi will take off on the 13th, 14th and 15th of May. On Friday, 6 flights headed home. The first flight to land was from Singapore. Air India's B787 flight brought back 234 Indians and it landed a little after noon in Delhi. Another flight from Dhaka ferried Indian students to Srinagar. With around 165 medical students on board, Air India evacuated the first batch of Indian nationals that were stuck in Bangladesh due to the lockdown. The students thanked the government for bringing them home. A total of 7 flights will depart from Dhaka under the Vande Bharat mission.
We are really happy and we are thankful to the government of India. They have really helped us a lot in these difficult times. And we are thankful to our Prime Minister Narendra Modi. He really helped us a lot.
The third flight to land was from Riyadh to Kozhikode with around 145 passengers on board. The fourth flight, carrying 152 passengers, 25 children and 5 infants from Bahrain, safely landed at the Cochin International Airport.
इंडियन गवर्नमेंट को और तो मेरा केरला का गवर्नमेंट को भी बोलेगा सब लोग को वो लोग अच्छा सपोर्ट दे दिया बहुत बहुत धन्यवाद सब लोग को मैं एक बार भी बोलता है सब लोग डरने का नहीं है कोई मैं आज गया कल का फ्लाइट में नहीं तो परसों का फ्लाइट में तुम लोगों को भी उन दिनों में से रोक जाए
One of the most happiest days I think in my life because the long uncertainty is almost over and I get to fly to my homeland. This is currently I'm almost like 7 months pregnant, so it was quite uncertain when I could be flying around after 32 weeks. None of the airlines would be allowing to fly.
While the last 2 flights of the day came from Dubai, one carrying 179 passengers and the other with 177 passengers on board. They landed overnight in Chennai. Almost 200 workers, 37 pregnant women and 42 medical cases were on the 2 Chennai-bound flights from Dubai. The rest were elderly people, stranded tourists and families of those travelling. The central government is planning to operate 64 flights from May 7th to 13th to bring home around 14,800 Indian nationals stranded abroad due to this COVID-19 lockdown. Moving on, Indian Navy has launched Operation Samudra Setu, meaning Sea Bridge, as a part of the national effort to repatriate Indian citizens from overseas. Indian naval ships Jalashwa and Magar are part of the first phase of evacuation operations from May 8th. In the first phase, Indian naval ship Jalashwa left from Mal in Maldives with 698 passengers. Undertaking suitable preparations for the evacuation by sea, the ship will reach Kochi in Kerala tomorrow. Medical teams undertook preliminary COVID screening of all passengers, while INS Magar will bring back Indians from Maldives next week. Back home, taking a look at migrant labours, thousands of migrant workers stranded in various states due to the countrywide lockdown imposed as a precaution against COVID-19 finally reached their homes on special Shramik trains launched by the government to help stranded people return home. So far, more than 3 lakh such passengers have been ferried by around 265 Shramik trains. Southwestern Railway yesterday operated 4 Shramik special trains. 2 trains each carrying 1,200 passengers each left the Chikanbarwa station in Bangalore to Lucknow. The third Shramik train left from Malur in Bangalore to Danapur with 1,200 passengers and 7 children, while the fourth Shramik special train left for Hatia. Southwestern Railway has operated 11 Shramik special trains based on the demand of state governments for citizens to return to their hometowns after the lockdown due to COVID-19 pandemic. These special trains are being run from point to point with no stoppages en route. Trains depart the stations only after all the passengers are medically examined by the respective state governments with a medical certificate. The Railway Protection Force team is escorting the trains. According to the Ministry of Health and Family Welfare, 59,662, that's the total cases that have been registered in India. These includes 39,834 active cases, 17,846 people have been cured, while 1,981 people or persons have lost their lives. That's the latest numbers, purely looking at the total number of cases, 59,662. The death toll standing at 1,981, while those cured are closely inching towards the 18,000 mark. Taking a look at the states that have been affected, Maharashtra, the epicenter of COVID-19 in India, 19,063 cases. Gujarat with 7,402. Delhi 6,318. While Tamil Nadu completing the top 4 states that have been affected with 6,009 cases. Moving on, Director General of the Council of Scientific and Industrial Research, Shekhar Mande, has said that CSIR is working intensively with many pharmaceuticals to bring upon solutions against COVID-19. The Drug Controller General of India has given approval for clinical trials of Favipiravir, which is used in influenza in Japan, China, and several other countries. The drug can be potentially useful against COVID-19.
CSIR is working with multiple pharmaceutical companies in trying to see whether we can bring certain solutions to the market as interventions against COVID-19. In this regard, a few clinical trials CSIR has already initiated in partnership with certain companies. The Drug Controller General of India has given us approval for 2 more clinical trials. One is on a drug called Favipiravir. It's a drug which is used against influenza in Japan, China, and other countries. And we believe that this drug also could be potentially useful against COVID-19.
Home Minister Amit Shah has written to the West Bengal Chief Minister Mamata Banerjee on the state's failure to make arrangements for the return of migrant labourers belonging to West Bengal who are stranded in various states. The Home Minister has told the Chief Minister that central government has helped more than 2 lakh migrants to reach home. Migrants from West Bengal are also eager to reach their homes. Central government is helping but not getting the expected support from the respective state government. Amit Shah has also written that the state government is not allowing the trains to reach the state. This is injustice with West Bengal migrant labourers, which will create further hardships for them. He requested cooperation from the West Bengal state government for making it possible for the migrant labourers to reach home safely in the eastern state. Moving on, Maharashtra Chief Minister Uddhav Thackeray has refuted rumours that the army is being deployed in Mumbai as the COVID-19 cases rise in the country's financial capital. The Chief Minister said that Mumbai police is capable of handling the situation, but additional forces may be sought from the centre if needed so that the state police force gets some respite.
Close to 3,500 people have been cured and sent to their homes because of COVID-19. But the worrying part over here is the number of Maharashtra state of positive COVID cases is reaching 20,000 mark. Many initiatives by the state government and local administration is being undertaken, and yesterday we also heard Chief Minister Uddhav Thackeray clarifying that there will be no military brought to the state of Maharashtra because each and everyone in itself is a warrior for the fight against the virus. Shama Mishra, DD India, Mumbai.
A WhatsApp message being forwarded saying that there will be a military lockdown in Mumbai for 10 days starting from Saturday. Press Information Bureau, that's PIB, however, absolutely denied such reports, and these kind of messages is nothing but fake news. No Army, Navy personnel are being deployed for maintaining law and order in the city of Mumbai. Let's also take a look at some other fake news making the rounds across the country through various social media sites. There is a news in the social media citing Dr. Sanjeev Relhan Bhatt saying that India is short on the PPE coveralls because of a quality control problem. However, the claim is entirely false, as the reality is that 8 labs have been approved, accredited to the National Accreditation Board for Testing and Calibration Laboratories, and the quality of PPE's coveralls is being taken very seriously. Another fake news that's related to an audio message has been made viral on social media, claiming that the centre is granting 3 lakh per COVID-19 patient to the state governments to look after patients. However, the reality is that the claim is false and baseless. In addition to it, the Ministry of Health and Family Welfare has also clarified that no such scheme is being run by the centre. Well, let's now take a look at some updates that inspire hope and positivity in tackling the coronavirus outbreak. Corona warriors across India are fighting the disease in innovative ways. In Uttarakhand's AIMS, that's in Rishikesh, they have devised a scheme which can go a long way in maintaining our healthcare capacity. Let's take a look at this report.
AIMS Rishikesh has come up with a novel solution to lessen the burden of COVID-19 on our healthcare system. A mobile app and a connected device lets doctors monitor the vitals of a patient remotely. System has been named Monal, the state bird of Uttarakhand, which is found in remote hilly areas. The control center set up in AIMS gives an alarm when the patient needs hospitalization. This automatically triggers an ambulance being dispatched to patient's home.
एक ऐसा सॉफ्टवेयर है जिसको एक मोबाइल एप्लीकेशन के ज़रिए कोई भी पेशेंट अपने मोबाइल पर डाउनलोड कर सकता है और उसमें एक छोटा सा फॉर्म अपने मोबाइल नंबर को वेरीफाई करके ये बता सकता है कि उसको कोविड के लक्षण उत्पन्न हो रहे हैं। इस तरह से वो एम्स से जुड़ जाता है और हमारे डेटाबेस में एक पेशेंट रजिस्टर होता है जिसको लग रहा है उसको कोविड है। इसके उपरांत हम उसको फ़ोन करते हैं, उससे संपर्क में आते हैं और उससे डिटेल में पूछते हैं कि उसके लक्षण कैसे हैं और क्या वो कोविड हो सकता है या नहीं। अगर हमें लगता है कि वो कोविड नहीं है तो हम उसको फ़ोन पर ही काउंसलिंग करेंगे और उसको समझाएंगे कि घबराने की ज़रूरत नहीं है, आप हमसे जुड़े हुए हैं, आप दोबारा हमसे संपर्क कर सकते हैं। तो हमने एक डिवाइस बनाई जो हमारा हेल्थ केयर वर्कर उसके घर पर लगाने जाएगा और उसके ज़रिए श्वास गति, उसके ब्लड में ऑक्सीजन की कितनी मात्रा है, इसका अनुमान और उसका बुखार, ये मुख्यतः 3 ऐसे पैरामीटर्स हैं जिनको हम कोविड पेशेंट्स में देख रहे हैं। ऐसे पेशेंट्स को हम उनके घर पे ही डिवाइस देंगे और वो पूरी तरह से अपने इन सिम्टम्स को हमारे कंट्रोल सेंटर में दिखा पाएंगे। इसके लक्षण ऐसे हैं जो घर पे नहीं सही हो पाएंगे तो हमारी एम्बुलेंस लोकेशन के माध्यम से सीधे उसके घर पर जाकर उसको अस्पताल लेकर आएगी।
The system helps in solving the biggest problem of allocating the scarce healthcare resources to people who need it the most. The peculiar and favorable aspect of COVID-19 is that about 95% of patients do not need intensive medical interventions. The only treatment that they receive is regular monitoring of their vitals and generic medicines. But they end up hogging the healthcare facilities. Monal system will help this majority recover in the comfort of their homes with assurance that help is just around the corner. The second major benefit would be dramatic reduction in the contact between healthcare workers and suspected cases. This would bring down the infection rate in our doctors and nurses and help us in maintaining our healthcare capacity. And finally, this system would result in less consumption of PPE kits.
डॉक्टर्स जो इन माइल्ड पेशेंट्स के संपर्क में आके एक्सपोजर के कारण क्वारंटाइन हो जाते हैं उनका हम रिस्क रोक पाएंगे और तीसरा पीपीई की जो पर्सनल प्रोटेक्शन इक्विपमेंट की जो बढ़ती डिमांड है उसको हम कहीं ना कहीं उसकी डिमांड को रोक पाएंगे।
The device monitors heartbeat, body temperature, respiration rate and oxygen saturation. The app and device have been developed with the cooperation of Bharat Electronics Limited and Electronics Corporation of India. The device has been tested successfully on more than 200 patients and the app is going to be launched for public soon. Bureau Report, DD News, Dehradun.
A step in the right direction there in the state of Uttarakhand. Moving on, a student in Jammu Kashmir's Jammu region has painted slogans on a road urging people to stay home. The unique initiative in which a student has painted "Stay home, stay safe" slogans in Sarwal area of Jammu comes as the nation experiences its third phase of lockdown. The girl student has also been urging people to stay home and also emphasizing on the relevance and importance of the residing of people in their homes during this pandemic. In a one-of-its-kind move, Gajapati District Administration has the first mobile coronavirus testing van, which will enable health officials to collect samples at the doorsteps even in the densely populated areas of the region. This COVID-19 testing van encompasses testing facility, provision of disinfectant, drinking water, disposal of clinical waste, and a drawer for safekeep of swab. Adhering to the government guidelines, social distancing in mobile van has also been maintained, whereby 3 people can be accommodated inside the vehicle. People residing in all 149 Gram Panchayats of Gajapati will be examined for COVID-19 with the help of this mobile van, which has been developed in collaboration with the National Health Mission and ICMR. Also, this van will not only screen the locals for the disease, but also scores of migrants who are stranded in Andhra Pradesh border. With the ease in restrictions announced in the third phase of the nationwide lockdown, small workers and mechanics have been given a major relaxation. As come the summer, demand for the air conditioning repairing has been rising in Rajasthan's Jaipur district. Now with the restrictions eased, these workers are able to find sufficient work to earn their livelihood. Rajasthan has sealed its interstate borders as the number of positive cases rise, though the modified lockdown has been a big relief for the people as temperatures rise in the state.
With more than 3,600 positive cases and 100 plus deaths, Rajasthan is facing quite a challenge as far as coronavirus is concerned. The state government has sealed all the borders. But the good thing is, because of the modified lockdown, people have some relief. They can get their ACs repaired, the fans and all the electronic items can all be repaired, and also there is no problem as far as the essential commodities are concerned. Vishal Baristo for DD India, Jaipur.
Well, India Post, with its vast network of 1,56,000 post office, has once again geared up for performing as a strong COVID warrior. India Post has entered into a tie-up with the Indian Council of Medical Research, that's the ICMR, for delivery of its COVID-19 testing kits from its 16 regional depots to the 200 testing labs in the country. ICMR has set a target of carrying out around 1 lakh tests across the country every day. India Post has delivered consignments to remote areas including Imphal, Aizwal, Dungarpur, Churu, Jalawar, Kolkata, Bhubaneswar, Ranchi, Jodhpur, Udaipur, Kota and other remote places. These kits are being delivered packed in dry ice. Union Minister of Communications Ravi Shankar Prasad appreciated the renewed commitment and partnership between ICMR and the Department of Posts. He said Indian Posts have been delivering mails, medicine, financial assistance at doorsteps and even distributing food and ration to needy during this lockdown period. Well, moving on, let's now scan through the developments from across the globe in World Wrap. Well, COVID-19 cases continue to rise worldwide with over 39 lakh confirmed cases being recorded, while the fatalities have risen to 2,74,000 people having lost their lives, with 13 lakh people also having recovered from this deadly virus. The worst affected remains United States of America. The last recording of 1,635 coronavirus deaths in the last 24 hours. The US now has an overall death toll of 77,178 with more than 12,83,000 positive infections. The total number of people recovered in the country stands at 1,98,993. US President Donald Trump reached out to several world leaders to discuss the COVID-19 pandemic and the global economy. In other updates, US Vice President Mike Pence's press secretary Kathy Miller tested positive for COVID-19. Miller, the wife of White House immigration advisor Stephen Miller, tested positive on Friday, a day after President Donald Trump's valet had tested positive for the virus. However, officials confirmed that Trump had not had any contact with the infected Pence staffer recently. The United Kingdom continues to remain the worst affected country in Europe with over 31,000 coronavirus deaths. Considering the situation, Prime Minister Boris Johnson will not announce any dramatic changes to Britain's coronavirus lockdown, adopting a cautious approach to try and ensure there is no second deadly peak of infections. A cabinet minister said that the country is not out of the woods and that there isn't going to be any dramatic overnight change to the lockdown. Prime Minister Johnson is expected to set out a roadmap for the next steps following a review by ministers of the current measures. The toll rise in Britain has been roughly over 31,000. Moving to Italy, which has registered 243 deaths on Friday, bringing the total number of those who have died in the country to 30,201. With 1,327 more cases registered in the 24-hour period ending Friday evening, Italy's tally of infected cases stand at 2,17,000 infections that are positive. Lombardy in the north of the country continues to be the hardest hit region, accounting for nearly one-half of the latest cases registered on Friday. Meanwhile, churches in Italy started preparing for an eventual easing of lockdown restrictions and a resumption of public gatherings. However, government has urged people to follow safety rules amid partial ease of lockdown measures. Well, Dr. Ghansham Pangte, the professor at the Department of Medicine at LHMC, said that the patients with symptoms must be identified carefully and only those patients who require clinical medical support need to be admitted to the hospital.